Today we are doing a chest pack along with the Gynecomastia 360 square technique. It is difference. There's a lot of difference between Gynecomastia 360 square and a chest pack. I'm going to discuss this. Then we are doing the deltoids, biceps, triceps. So let me quickly take you through how we do the markings. So for the abdomen, we define where the natural packs are. So some patients may have 4, 6 or even 8 packs. So we see the upper limit by asking the patient to contract. So when they contract like this, then the muscle ridges are clearly visible. So the outer definition of the muscle is visible and the muscle packs just stand out. So we do the marking. This is part of what is the 4D body contouring, what Dr. 𝗬𝗓𝗂𝗧 invented more than a decade back. And this is the technique which I've learned from him. So we create the upper margin of the pack, then we define individual packs. This part has to be absolutely flat. The lower tummy has to be flat to give that athletic appearance. The two packs on each side are usually different. They're never the same. The earlier mistake, and many young plastic surgeons make that mistake, is they make a straight line. Never do a straight line like this. Always curved, irregular. Both the sides are never the same. You look at any muscular body, the two packs are never the same. So even in our patient, we can see there's a clear difference between the outline of the packs. Then we will just remove some of the extra fat here and create the external line, the external oblique line. We're also going to create the intercostal line here. So we are going to define this. It appears, the intercostal ribs appear nice and enhanced. Then we're defining the deltoids by again defining the margins of the deltoids. Then we'll do some fat injection of fat into the deltoid muscle. The biceps muscle and the triceps are also very clearly defined. And we'll also put some fat into the biceps to give a larger pumping effect. Now the chest. It is important that when you do your gynecomastia surgery, please make sure you do it the right way, the first time. Many patients make the mistake of not going to a well-qualified plastic surgeon, not discussing what is to be done, what technique is to be done. Today, gynecomastia should only be done by the Gynecomastia 360 technique, which maps out each segment of the chest and takes out fat from everywhere, removes gland, does not leave any fat behind, gives a good shape to the skin. Many times patients don't do that. Unfortunately, they don't have the knowledge or they don't discuss well with the doctor, and then they land up with asymmetries, skin deformities, presence of extra gland, fat is not taken out properly. So there are very clear definitions of Gynecomastia 360 technique. Always discuss that with your doctor. So you must get an estimate of what is the result going to be. Now, when we define the chest, the 360 square technique, we define the margins of the pectoralis muscle. We remove all the extra fat. Now, this is part of the 360 technique. Every doctor should be removing this extra amount of fat and this bra roll during the first gynecomastia surgery itself. If you don't remove this, then the patient will come back with bulges and it does not look very pretty. So choose the correct technique. Then we define the deltopectoral groove. Conventionally, this was not done. So we define this and really create this angle. And then we create the shadow below the collarbone or the clavicle. So this gives a box-like appearance to the chest, which is what healthy, people who go to the gym a lot have, that kind of a pumped up appearance. Lastly, we will inject some fat into the pectoralis muscle to pump up the upper part of the chest. And that is going to give a very nice athletic appearance. If you wear a t-shirt, the chest will just stand up like that. And that is what you want when you do this high definition procedure. It's a long procedure, takes approximately 4, sometimes 4.5 hours. Very safe, absolutely safe, and has amazing results. The only condition is the visceral fat. The fat inside the abdomen should not be too much. If there is too much of visceral fat, the bulge prevents the visibility of a good six-pack. Otherwise, you must exercise, you must diet and lose that visceral fat in order to get the best results. Post-operatively, it is essential that the patient maintains a fit routine of their life. Exercising, good food, not fasting, good quality food, good home food, less junk, less alcohol, less smoke, lot of vitamins, lot of nutrients, lot of proteins, mixture of carbs and fats. These are essential for a good nutritious diet. But exercising is essential too in order to get a better appearance from your chest pack.